from iHeartRadio. This is Medical Monday, presented by St. Dominic's. This is Randy Bell. I'm joined today by Dr. Ruth Fredericks, a neurologist and co-medical director of the Comprehensive Stroke Center at St. Dominic's. So, Dr. Fredericks, at the end of the month, World Stroke Day will be observed to raise awareness and promote action on stroke prevention. And there is a lot we can do, isn't there, to minimize our chances of having a stroke?
Yes, definitely. It's a very preventable disease in a lot of instances. The main thing is to control your blood pressure. Blood pressure is a silent killer. And if we can get people to regularly check their blood pressure, see their physician, and most of all, stay on their medication, be compliant with their medication, that is the number one reason that people have strokes in this area. The other things you can do is stop smoking. No question, that has a major impact on it, just as it does heart disease. We need to control diabetes. There's a lot of undiagnosed diabetes in our state. We run a very large stroke system of care at St. Dominic's. We have multidisciplinary rounds on our patients every day, and I can't tell you how many people come in with their blood sugar in the 500, 600 range and don't even know they're diabetic. And then just basically have your routine health checks to make sure your cholesterol is good, make sure that your arteries, when the doctor listens to them with a stethoscope, that make us believe that the arteries could be blocked. Also have regular heart checks, just EKGs after you're a certain age to make sure you don't have irregular rhythms. And just good nutrition and good follow-up medical care. Just even a once-a-year visit to your doctor just for a checkup will make such an impact on your overall health, especially with any of the risk factors that are associated with stroke.
And this is a serious health problem, health issue for Mississippi. I understand that strokes, along with heart disease, account for over a third of all deaths here in this state.
That's true. Nationally, we see around close to 800,000 strokes a year. It, as well as heart disease, are extremely common in this state.
There are two kinds of strokes, one involving a blockage, the other bleeding in the brain. Talk a little bit about, the difference in the two.
We have ischemic strokes and we have hemorrhagic strokes. Ischemic strokes are more common. They are due to blockages in arteries or due to heart disease. The ischemic strokes basically are much more likely to be caused by tobacco, whereas the hemorrhagic strokes are likely caused by undiagnosed or untreated hypertension.
Let's talk about the warning signs of a stroke.
FAST is an acronym that we use. Face drooping, whereas the face is weak on one side. There's unevenness in the smile. Arm weakness, where the arm becomes acutely weak or numb, or any limb, really, arm or leg. And speech difficulty. If the patient notices that they're slurring their speech or they can't find words and can't talk, we call it word salad. It's like their words are all mixed up. The syllables in their words are mixed up. If they have that, then you need to think that there's been some acute event that caused it. And then the T for the acronym FAST is time to call. You want to call 911. Very important that we call 911 because we're so lucky to have really good emergency services in this state, and we have a stroke system of care through the health department where there's so many people that are trained on how to acutely take care of a stroke. The EMS system, these guys are well trained, and they will be able to evaluate the patient in the field, at the home, and decide if the patient is having a large vessel stroke or a small vessel stroke. If they think it's a large vessel stroke, they'll try to get them to one of the more comprehensive centers where they can be taken care of with intervention. We can now pull clots out of vessels in the head, the arteries, and we can do thrombolytics, or we give clot buster drugs to stop the stroke. But you want to get them to a hospital that can accommodate this. And so EMS is well trained in evaluating what they can evaluate in the field without scans. They can evaluate and decide if this is a large vessel or small vessel stroke, and if the patient possibly needs a more comprehensive type stroke center. You always want to call 911. You want to dial and not drive. In other words, you want to dial the number 911, let them come and get you there quicker and where you need to be.
Dr. Ruth Fredericks with St. Dominic's. I'm Randy Bell.